Welcome back. This is episode 6 of Questions from the Waiting Room. I'm here with Dr. Nicholas Pejic. I'm Emily Harper, social media coordinator. As a recap, these are questions patients might be a little bit too scared to ask their psychiatrist.
Let's do it.
Lily S. from Colorado Springs, Colorado. She wants to know, how does someone get a mental illness? Is it from emotional trauma or is it a chemical imbalance?
Well, mental illness, there are all kinds of mental illnesses out there. If it's something like schizophrenia, schizophrenia is an illness where you can hear voices that other people don't hear, or you become paranoid. That's probably more hardwired, as we would say. So I don't know if it's like a chemical imbalance per se, but in the brain, you have nerves that speak to each other, and the nerves carry electrical pulses, and then the nerve from that electrical pulse squirts out some neurotransmitter, and then the second nerve senses those neurotransmitters. So it's kind of weird. It's like you have this wire with electricity, and then you have like a bowl of water, which is a synapse, and then you have another wire, and they have to communicate through the chemical, which is neurotransmitter, and then a receptor to sense that. So in something like schizophrenia, there's an idea that somewhere in that network it's off. In some parts of the brain, maybe there's too much dopamine causing hallucinations. In some parts of the brain, it might be a lack of dopamine, which can cause like amotivation, like low motivation for folks who suffer from schizophrenia. So in that sense, it might be chemical imbalance, right? And there's probably more to the story with schizophrenia. I'm kind of just super simplifying it. Whereas in generalized anxiety disorder, where people worry excessively, some people might have developed that from being around people who worried a lot around them. Maybe they learned to worry throughout their childhoods and didn't have as much certainty, and they have to unlearn that. That's more of a nature versus nurture. It's like the nature side of things. But there are people indeed who genetically, I think, are worry warts, and the part of the brain called the amygdala, which is like the fear center that helps you sense things and decide whether or not somebody is a threat or something's a threat. It might take in too much information. That could potentially be genetic as well. And I certainly have met patients where they're like, yeah, my grandmother worried, my mom was a worrier, I am, my sister is, so on and so forth. So mental illness basically could come from genetics, especially for like the more debilitating disorders like schizophrenia, or they don't, and it's just an exaggeration of one's fear response that's not controlled. I like to also put into context what the patient's symptoms, right? So if we, after a hurricane down here and you got to get gas and drive up north and you can't find gas and you're looking for water, okay, that's a whole different set of, a different context. But if somebody is a worry wart and they go to work and they're just worrying all the time, like the boss doesn't like me type of thing, then that's different. And the way we differentiate these sometimes is just how long a disorder lasts for somebody. So for generalized anxiety, they usually have symptoms for about 6 months or more. Whereas an adjustment disorder, where somebody's adjusting to life circumstances, usually is much shorter than that.
Marcel H. from Eugene, Oregon. What's the best treatment for a severe narcissist?
I don't think there is a treatment for that, because people with narcissism tend to not show up for therapy unless they have a narcissistic injury, which is like rejection or their sense of grandiosity of how big they think of themselves, which is out of sync with what reality really is, the realistic situation really is. So folks who've had that balloon pierced and they feel deflated. Sometimes it can be serious and they'll have a suicide attempt, or they'll come into therapy or to see a psychiatrist because they're depressed, because what reality is now reflecting to them is they're not as great and as beautiful as they thought. A lot of narcissism is underpinned by low self-esteem. A lot of times folks who have that have had that have been devalued throughout their life, or they get much worse. Well, I don't know if it's much worse, but they get, one parent is overvaluing them, saying that they're all great, while the other parent might devalue them. So they kind of get a topsy-turvy sense of themselves. And to defend against that, psychologically, to defend against the pressure of that, they might develop a grandiose sense of self. And then they tend to lack empathy about other people. They tend to be entitled, like cutting in the line in front of people and justifying it or whatever it might be. So when you have somebody like that, a lot of times they're so defended that they don't recognize that they have something off. Or if they do, they kind of just tolerate it and they still will be entitled anyways. So they don't typically present to seeing a psychiatrist or a therapist. Now, if they do present, and it's because their self-esteem has been damaged even more because they've been rejected, then we usually treat the patient as we would treat any depression or anxiety, but we may recommend that they do some deeper work in therapy. But if you get somebody with severe narcissism, it's hard to kind of keep them on the couch. I've had in the past where folks come in and sometimes they're help rejecting. Like I might say, this is what we can do for you. This is what I recommend. But they're complaining a lot about their problems, but then they don't want me to actually help them. They just want to be right or know what to do anyways. It's a weird feeling for a clinician, or weird situation for a clinician to be in. Now, the other question people are probably thinking was, well, am I a narcissist? Like, are they narcissistic? Usually if you're thinking about that, you're probably not, or not as much as somebody who's completely defended and highly narcissistic. There's also healthy narcissism. One has to think well of themselves enough to start a business or to go for that promotion. To do things in life, you have to have a healthy dose of, I think I can. And you can't be too deflated. And that's where it's confusing to folks between what's normal, healthy narcissism versus like what's an abnormal, severe one. Yeah.
All right, Barbara H. from Green Bay, Wisconsin. What mental illness are you tired of seeing in movies and TV?
I'm tired of seeing movies and TV. Oh, some of the thriller movies that talk about psychosis, and whether it's ghosts or a rendition of someone's psychosis. I don't know. There's some really good ones. I think the Black Swan is that right, with Natalie Portman? I think she developed some kind of psychosis in there. That's artfully done, well done. But when I see that type of one, I guess I'm helping people who really have psychosis. And so when you see it on display, unless it's really trying to speak to the disorder itself and one's suffering through that, if it's capitalizing on it and making it more than it is, then I don't really like it. So I don't know.
I think that's fair enough.
Yeah.
That's what I've got for you this week. And until next time.
Okay. Thank you so much. See you, Emily.
Bye.